27-year-old Evan Snyder has been a part of Wonder Why Farm since he was born.
I'm the 5th generation to be here, so this place has been around for a while in our family.
The legacy lives on with Evan. Now he helps run the farm.
I take care of the animals. We have 20,000 turkeys and 5,000 pigs and a few hundred head of steers and like 100 goats and lambs. So pretty much just making sure everything's running smoothly and everything's good.
Evan had to take months off because he was very sick.
I started to feel bad on a Sunday, and I thought I had a kidney stone, and I just kind of downplayed it. And then on a Thursday morning, I finally went to the hospital.
He came to us because he had had a terrible bout of diverticulitis, which is an inflammation of the colon. And his was so bad that he actually perforated a hole in his colon and had peritonitis and was just very, very sick.
He was essentially in septic shock as a result of the perforated diverticulitis. He was in renal failure and required dialysis. He had actually had a cardiac arrest and had undergone CPR.
And he actually ended up with an end colostomy, a colostomy bag, because of the surgery.
It was just really scary. And we just didn't know what was going to be next.
I was in a coma for 7 or 8 days, and then I was in the ICU for another 6. I had to go to a rehab for a few weeks also to get back on my feet because I was flat on my back for a while. I couldn't even really walk.
When he finally got better, he also had a hernia in his midline wound from that operation.
And then I went back to the doctor in the fall of 2017, hoping to get the news that I would have my hernia repaired and my colostomy reversed.
I spent that first clinic visit talking with him about not the hernia, but talking about getting his weight down, getting his ostomy reversed, and then talking about how we would address the hernia during the course of one of those 2 operations.
Dr. Paul, I said, well, you need to lose weight. He says you need to be under 300 pounds, or it was a BMI of 40.
Weight was always a challenge for Evan.
I never really ate like bad things. I just ate way too much of everything else. You know, I'd have like, instead of just having a sandwich at lunch, I'd have 2 or 3, and I'd snack all day.
I thought he looked good when he graduated. But now when I look at him, I'm like, oh my word, he was just really, really overweight.
I would try different diets, you know, the ones you see on TV. They say, you know, lose 25 pounds or lose 50 pounds fast. And if I'd try it for a week and I'd either get tired of it and just give up, or if I didn't see the results I was looking for, I'd just give up.
Probably twice a year, I think he had to get bigger clothing. So that was hard, and it was hard for him because he couldn't shop where other people shop.
The highest I got to was 440 back in January 2017.
I didn't know that he was that heavy until I seen, when he was in the hospital, I saw the number and I was shocked.
Now Evan had to make some life-changing choices.
Dr. Paul came to me with a pamphlet with Dr. Rogers on the front of it, saying that I should make an appointment with her and see what she has to say about it.
Evan enrolled in the Penn State Health Surgical Weight Loss Program immediately.
He had a pretty typical 6-month program with us, with education, with the dietitians, and with behavioral health, psychological testing and evaluation.
She said I needed to take their classes to pretty much learn about how to take care of my weight loss.
We try to give them the education that they'll need so that they'll know how to eat safely after they have the operation.
I mean, pretty much changing everything I do. I mean, we're farmers, so we eat a lot of meat, we eat a lot of protein, but you don't have to have 2 or 3 hamburgers. You can just have a small portion and still get plenty of nutrition out of it.
He was excited about it. I mean, he really was. It was like almost a countdown to getting this done.
The week before my surgery, you only have liquids, and I think I lost 15 pounds in the first week before my surgery, so I was already really excited.
He had the sleeve gastrectomy, which is the most common operation for weight in the world. With the sleeve gastrectomy, we remove about 70% of the outer stretchy part of the stomach. A patient is left with their own tube of normal stomach, but it's not stretchy at all. It doesn't have much give. So it's a smaller stomach than ordinarily they would have. It also removes a lot of the cells that create ghrelin, the hunger hormone. So sleeve gastrectomy patients tend not to have so much hunger all the time.
In March when I got my surgery until the end of April, so like a month later, I think I lost like 40 pounds. So it was an awesome feeling knowing that it was starting to work already and that things were headed in the right direction.
The weight continued to drop.
I had another appointment in August of 2018 with Dr. Pauli, and I went and I weighed 275 pounds. And I had to be under 295 because he wanted my BMI under 40. And I had made it by over 20 pounds. So I was ecstatic, and I think he was too.
We did, for our hernia center, a relatively straightforward operation called a component separation, where we take the layers of the abdominal wall and we separate them, and we put a layer of the patient back together, and then a big piece of mesh to reinforce, and then we close the muscles back together. He went to the operating room with an ostomy bag and a big hernia, and he woke up with neither of those things.
A life-changing operation for Evan.
I can't believe I've lost almost another 80 pounds since then. I kind of thought I would slow up, but I steadily have lost in the year past since then, and now I'm down to 195. This is the barn coat I used to wear before I made the transformation. It's a size 6X, and I used to wear a size 52 pants, and I'm now down to extra large sweatshirt and size 32 pants.
I just think he thinks that he can take the world on, and I mean, he can. You know, that's, as a parent, you always want your kids to think that, but now he knows he can.
I'm happier, I feel better. I think people enjoy being around me a little more because I'm not always tired and worried about food. I can go out and enjoy myself and do so many things that were never possible only a few years ago. I feel awesome. I feel like a whole entirely different person now.